Gauteng MEC for Health and Wellness, Nomantu Nkomo-Ralehoko, will today be visiting the Gauteng Emergency Medical Service Operations Center in Midrand. This is to evaluate the effectiveness of medical emergency responses implemented since the start of the festive season. For more on this now, here's reporter Lerator Makola joins us now for an update. So Lerator, what's happening where you are right now, and what are the community members saying? Is emergency medical services effective?
Live from Midrand at the Gauteng Medical Emergency Services Operations Center, where MEC for Health and Wellness, Nomantu Nkomo-Ralehoko, is here to check on the update as on the progress of the Operations Center since the beginning of the festive season. But right now with me, I have the CEO of the Medical Operations Center, Ruben Ritas, to tell us more about this. Thank you so much for your time, Mr. Eritis. Can you please tell us about the Operations Center? Because you've mentioned that you monitor the movements of the emergency vehicles and you also track the high cost of volume. Can you please tell us more about that?
Yeah, thank you. Yeah, so being the emergency center for Gauteng EMS, this is the point where all communities make first contact with our communities and the health system. And in here, basically, the setup here is into three phases, where we have call takers that are engaging with the communities. We have the dispatchers that are engaging with the vehicles and our sister departments. And in here, what you see here is what we call our Provincial Health Operations Center. So here is where we sort of summarize, and we summarize all operations, and we have a high-level view of how's the performance out there in terms of the call takers inside here, in terms of our operational staff, in terms of what kind of emergencies we are receiving and where are they happening, so that we can adjust and deploy our resources accordingly. We also have systems in place here where we monitor performance of each and every station on real life as to are they rendering the service as per the required standards and the care that is required out there by the community. We also have systems in here where we also monitor the communications and also, most importantly, the safety of our paramedics, because we're also having tracking devices that we have put in place so that we can know where they are, should they need a distress, and we need to send a request SAPS or any law enforcement to go and assist. We know where their location is so that we can do so.
And can you please tell us about safety when it comes to safety or to your emergency personnel, because we know that the ambulances are being attacked as well. Can you please tell us about the safety of your emergency personnel?
Yes, so currently we are very relying with our CPF community, the community policing forums, our different security clusters, the police and law enforcement. So because we have measures in place where we work very, very closely with them so that they know where's our areas. We've also identified areas that we classify at red zones to say when we go to these particular areas, we normally alert the law enforcement to say we are entering the space or it's too violent, we are maybe attending a gunshot, so we cannot enter because of the incident by its nature. And normally, we just hope that the community also, will come up for the paramedics in protecting the paramedics. But question is our paramedics at risk? Yes, always. We are always at risk because some patients fake, some criminals fake as being patients, and then they end up pulling guns out on our paramedics or knives and robbing them from their belongings.
Okay, maybe Mr. Ritas, you can just show us what's happening here. Maybe we can walk there and just show us and explain to us a little bit what's happening here. And maybe you can tell me about the hotspot areas like Hillbrow. What can you expect from that?
Yes, so from this side here, it's basically we are monitoring our internal performance, being our call taking, dispatching capability, and as you can see, we are also monitoring the staffing levels, the average answering speed of how quick our team members are engaging with the community. And you can see currently our answering speed on all our lines is average of 5 seconds that we are performing, which is a good performance. And we also note also the abandoned calls. So these are the type of calls where somebody makes a call, but the call doesn't get answered. So we have to zoom in as to why is the call not being answered. But you can see currently we're having about 8 of them. But looking at the time of them taking about 4 seconds, we know that it might be either a prank call or a pocket dial or so. So we are not really concerned, but the call is as a result that somebody held too long to be answered. So we are monitoring that here. And on the other screen here, we are monitoring our different types of incidents at all districts. As you can see, currently since the morning, we're having a total of about 174 incidents. And if you categorize them, there's medical incidents, there's interfacility transfers, there's also suicide and trauma incidents. So we're having a global picture of what is happening within the province and also determining which district is the busiest, because what we do, because our services are not necessarily confined to a particular district. Should we pick up that a particular district is having high influx of incidents, our vehicles, our resources are not district bound. They can cross borders. We can assist because it's a provincial service. So that's what we are monitoring, and we're making decisions of the.
Okay, Mr. Richards, I'm so sorry. And when it comes to the hotspot areas, what can we expect? Since we know that tomorrow is Christmas Day.
Yes, we have measures in place through our security cluster planning for the festive, and there are plans in place. As you might have seen that our crime wardens were very visible in the townships, at malls. So that's part of the plan that. The more they are visible, the more CPF members are visible, security clusters are visible. It means that we are likely to have incidents in these hotspots. But we continue to alert them as we enter these areas of hotspot, especially during nighttime. We always require assistance where they accompany us into these areas.
Okay, thank you so much for your time, Mr. Ritis. Well, that was the CEO of Medical Services here, Operations Center, Mr. Ruben Ritis, telling us more about today.